Hello, this is Spellbinder with two articles. Both of them as crazy as the first. This first one here is the most craziest one, and this comes out of the Obama Nation Healthcare, or the Obamacare Endgame. Doctors will be fined or jailed if they put patients first, by Dr. Elena George. If Obamacare is completely implemented, doctors will no longer be practicing medicine. They will instead become the drones tasked with deciding who gets the meager healthcare crumbs doled out by the bureaucrats and who have the ultimate power over the patient's life and death. Those who are deemed to have illnesses that require treatments which are too cost-effective can expect a one-way ticket to a hospice or a death camp. Thank you, Dr. President Obama. Let's see. Like so many bills passed in Congress, there was hidden provisions in the stimulus bill in 2009. It spends $1.1 billion to create an important piece of the framework for the health care bill, and called the Coordinating Council on Comparative Effective Research. It is based on the false premise that doctors in consultation with their parents don't have the ability to make the right health care choices, but yet some council of bureaucrats do, that Obama will choose. See Executive Summary. The council consists of 15 people, faceless people appointed by the president, unvoted, unelected, that will take care of you, the people. Yes, they will. They are going to take care of you, and it's not the good way. They all have one thing in common. They are all isolated. They are all isolated from day-to-day patient care, and therefore are insulated from the real practice of the art of medicine. It makes it easy to see patients as a cost center to be controlled, with views of members like Dr. Emiel, who champions the complete live system. It is hard to ignore the probability that senior citizens, those with chronic illness, and the very young will be on the outside looking in. This council is another example of the people of this country being told by the government that it knows what's best for us. In other words, you can't make your own decision, but they can. The framework set up by the stimulus bill merely set the stage for the implementation found in the healthcare reform bill. How can the government get doctors to participate in the Obamacare, thereby A, willing to destroying the doctor-patient relationship, and B, betraying the Hippocratic oath to provide treatment that they deem to be either effective? Simple. Fear and intimidation. A second board created by the stimulus bill, called the National Coordination for Health Information Technology, will determine treatment at the time and place of care. They are charged with deciding the course of treatment for the diagnosis given by the doctors. Now it becomes obvious that why there has been a big push towards the implementation of universal electronic medical record use. It becomes a total to complete control of the physicians and the patients. Those physicians and hospitals that choose to practice individualized patient care and consultation with the patient will be punished because they are not meaningful uses of the system over time. Beginning January 1st, 2013, penalties for doing the right thing for a patient will cost the doctors $100,000 for the first offense and jail for the second offense. This will have a chilling effect and may be the straw that completely breaks the foundation of good medicine, the doctor-patient relationship. Can you believe they're going to try to pull this over us? This is craziness. That's one of those bills that Congress had to sign before they could read it. 46% of physicians in the survey by the New England Journal of Medicine stated that they would leave the practice of medicine if Obamacare care was implemented. This will only further decrease the quality of health care when the 30 million more people enter the system. Maybe that's why there's a big push in the health care bill to increase the number of other providers, such as physician assistants. Instead of real doctors, you're getting an assistant to make judgment on your health. And nurse practitioners, not real nurses, it's practitioners of nurses. There is no question that the rationing will become our future if you add 30 million more people into the system with fewer resources. How could you possibly avoid rationing? Perhaps those members of Congress who passed this nightmare don't care, since they made sure that it wouldn't apply to them because they have their own personal physicians. Do you? This is just another tentacle of the giant octopus of Agenda 21. This is all this is. This is how to get rid of the population in a short order manner. And then there's this article, another crazy article, which is more actually a continuation of one of my other videos on the vitamin supplements that they're getting ready to take away from Europe. And here it is. It says, if you use herbs and supplements, you've been betrayed by lawmakers. A highly urgent message by Dr. Mirkola, October 26, 2010. And you get a link to all this. At the end of this video, I'll have a link to all this stuff. It says, in less than a year, virtually all medical herbs will be illegal in the European Union. In their take-no-prisoner strategy to wipe out every penny of competition and gain complete control of the health of the people, Big Pharma and agribusiness have scored a major win in Europe. Similar, potentially devastating battles are also underway in the U.S. How can this be happening? Well, it's easy. The secret weapon used by the drug companies is trade law. According to the Gaia Health, rather than treating food and traditional medicines as health of human rights issues, they have been treated as trade issues. See, they don't care about you anymore, the people of this world. They just care about the bottom line and the bucks in their pocket. These people need to be removed from their power points. They need to be prosecuted and imprisoned. That makes the desire of large corporations the focus of food and herbal law. See, now it's food and herbal laws rather than the needs and desires of the people. It's this twisting that has resulted in the FDA making outrageously absurd statements. The FDA, the Food and Death Administration, get that straight, it's not the Food and Drug Administration, it's the Food and Death Administration, making outrageously absurd statements such as claiming that Cheerios and walnuts quite literally become drugs simply because of health claims made for them. See, hearsay now becomes laws to their minds, or facts, like CO2 and sunlight is all bad for you. Yes, don't get out in the sun without your sunscreen, you know, the stuff that blocks your vitamin D intake and gives you cancer. Yeah, sunscreen is giving people cancer. Anyways, let's go on. Even though, says Dr. McCullough's comments, even though I generally believe that many people take far too many supplements and that supplements are a poor substitute for improving your diet, it is clear that some supplements are highly beneficial, and supplements in general are clearly safer band-aids when compared with expensive and potentially toxic drugs, and I'll quote, made from oil products, made from oil, put that right, the derivatives, they're able to synthetically produce these drugs from oil. That said, in order for all of us to take responsibility for our own health, I believe we must never lose the right to choose and buy nutritional supplements. Unfortunately, your health freedom is being encroached upon at this very moment. The European Union stands opposed to enacting into law a directive that may have a devastating impact on Europeans' freedoms of choice in regard to supplements. The practitioners of ancient medicine and the traditional Chinese medicine may lose their ability to prescribe the traditional herbal remedies. And once the EU enacts this law, I can strongly assure you that the United States will not be far behind. I usually urge the American readers to take action, but in this case, the action call at the end of this article goes to all my European readers. Please be sure to distribute this information to your family, friends, and social networks, and ask them to join you in taking action as well. That's how this goes. The restrictive EU herbal directive posed to become law next year, as described in a recent article by Alternative Health Zine, and European Directive on Traditional Herbal Medicine Products was enacted back in March of 2004 and will become law as of April 1st, 2011. So the THMPD is going to be God over us. But the groundwork was laid well before. In 1998, or so the EU said, they had received a large number of complaints from companies who said that it was difficult to sell their herbal products in other member countries. So the EU does, they said, let's harmonize the herbal regulations in all EU countries. This approach had some merit. For everyone to follow the same rule in every country, it is easier to produce and be sold to each country rather than exporters having to accommodate different rules in every country, so it's okay for exporters. Well, in essence, this directive created new rules and regulations for herbal products and nutritional supplements that were previously traded freely. Any supplier within the EU who wants to sell their product to another European country will need to get the license for each and every supplement they sell. In fact, under this directive, all supplements, herbal preparations must go through the same licensing procedure as pharmaceutical drugs. And TCM and Ayurvedic formulas that contain a number of herbs, and each herb would have to be licensed separately. The cost alone would undoubtedly drive most supplement makers and herbal manufacturers off the market, according to the Gala Health. The estimated cost per nutrient or herb ranges from 80,000 to 120,000 pounds, or around $126,700 to $190,000. It will take a mass public outcry of epic proportion to stop this draconian rule. Fortunately, the process has already been started. The Alliance for Natural Health and International is challenging the THMPD, and according to naturalingredients.com, the ANH is prepared to take the case to the European Court of Justice, but they will need your help, so please review the action items at the end of this article. As we stand above this encroachment on your personal freedom stems from the fact that companies want to be allowed to trade freely between countries without having to comply with each other country's individual requirement. But it's also part of a parcel to the grander scheme of Codex Alimentarius. And this is what this is all about, really. What is Codex Alimentarius? Well, Codex Alimentarius Commission was created in 1962 through a series of relationships between the World Health Organization, WHO, and the Food and Agriculture Organization, FOA, and the World Trade Organization, WTO, and the FDA, or the Food and Drug Administration, and the USDA. The Codex Alimentarius itself is a compilation of food standard codes of practice and guidelines that specify all requirements related to foods, whether processed, semi-processed, genetically engineered, or raw. Their purpose is to protect consumers' health, ensure fair business practices within the food trade, and eliminate international food trade barriers by standardizing food quality. It sounds all good and well. There are major problems with the strategies they use to keep you safe. They have now said everything's toxic. Codex uses toxology to assess nutrients. There are many problems with Codex, and it may not be immediately recognizable unless you have a proper perspective. But one of the most bizarre and potentially dangerous issues is their vitamin mineral guidelines, finalized July 4th, 2005, which classifies nutrients as toxins. Yes. What you end up with when you use risk assessment to assess the safety of nutrients. Risk assessment is a branch of toxinology and also known as science of toxins. In a sane world, it is used to assess how much toxic substance you can safely consume without noticing any physical effects or problems. As soon as there is a biological effect, you have hit the upper maximum limit of that substance. Well, Codex Alimentarius has slowly but surely been shimmying into position and to mandate a universal maximum of safe level of every vitamin, mineral, supplement, and herb that may legally be manufactured, used, or sold, with safe being a level that has no physical effect. People, they're going to make vitamins ineffective, under prescription, and cost a lot of money. That's what this is saying. However, this is not a cut and dry process. It has been going on for nearly 50 years, and it's now likely to take many more years before all their plans are completed. See, the Codex agenda is inched forward one piece of legislation at a time at different times in various countries. However, in the end, we can never take our eyes off the final goal with its global harmonization of Codex, insanely restrictive rules, and flawed ideals about nutrition, and the EU's herbal directive is likely an important piece of this giant jigsaw puzzle. Once the directive takes effect, a vast majority of herbs and supplements will vanish from the market simply due to prohibitive cost of testing and licensing. Whatever is left will most likely in the end become restricted to doses to have no beneficial impact on health whatsoever under the Codex vitamin and mineral guidelines. And that's it, people. I'll have this all posted. Good day.